Good afternoon, everyone, and I hope this message finds you all well. We just dodged another hurdle in 2020 by having this storm just miss us and not give us the 18 to 24 inches of snow that we were expecting. Today we have Dr. Singh to speak with us about vaccine. So without further ado, Dr. Singh.
Thank you, Mayor Davis, for providing me with an opportunity to deliver some facts to our community about the vaccine and the vaccination process. The pandemic has been stressful for many people. The first step is to acknowledge the disruption COVID-19 has caused in all our lives, providing us with opportunity to recognize common concerns that can be addressed by a vaccine. Let's talk about a few facts. There will be limited COVID-19 vaccine available in 2020. It is anticipated that the vaccine supply will increase substantially by 2021. The goal is for everyone to be able to easily get a COVID-19 vaccine as soon as large quantities are available. However, not everyone will be able to get vaccinated right away. Let's talk about the vaccine. It is a novel vaccine. Like all vaccines, COVID-19 messenger RNA vaccines have been rigorously tested for safety before using or bringing it for authorization to use in the United States. The messenger RNA vaccine and the technology is new, but not unknown. They have been studied extensively for more than a decade. mRNA vaccines do not contain a live virus and do not carry any risk for causing disease in the vaccinated person. It's currently authorized vaccine, and most vaccines under development require 2 doses of this vaccine. The first shot helps the immune system recognize the virus, and the second shot strengthens the immune system and the response. You need both the shots to get the best protection. All COVID-19 vaccines were tested in clinical trials involving tens of thousands of people to make sure they meet safety standards and protect adults of different ages, races, and ethnicities. There were no serious safety concerns. CDC and the FDA will keep monitoring the vaccines to look for safety issues after they are authorized and are currently in use. Some recommendations. CDC recommends that you get vaccinated even if you have already had COVID-19, because you can catch it more than once. While you may have some short-term antibody protection after recovering from COVID-19, we don't know how long you will have this protection and how long is it going to last. COVID-19 vaccination is especially important for people with underlying health problems like heart disease, lung diseases, diabetes, obesity. People with those conditions are more likely to get sick from COVID-19. Hope this information was helpful, and it'll be useful in making right decisions to protect yourself and your loved ones. Again, Bayonne Medical Center is collaborating with Mayor Davis, the City of Bayonne, to assist in achieving the goals of vaccinating our community in a fight against COVID-19. I want to talk a little bit about the categories of people who will be getting the vaccine initially. There are 3 phases that the Department of Health has created: Phase 1, Phase 2, and Phase 3. In Phase 1, there are 3 categories: Category 1A, 1B, and 1C. Category 1A are the frontline workers with high risk, medium, and low risk who are more prone to catch COVID-19 because of the risk or the work environment they are in. This would include hospital workers, paramedics, long-term nursing home workers, dialysis workers, and some other categories. Category 1B are our police officers, fire department, and some other healthcare workers who pay home visits, offices and practices. Category 1C are other individuals with high risk, morbid conditions, and high vulnerability indexes. Phase 1 will have limited supply of vaccines. We anticipate that Phase 2 and Phase 3 should see substantial supply of vaccines delivered to us by the Department of Health. I hope this information was helpful in answering some of the questions that you might have or have been thinking about. I want to again thank Mayor Davis for providing us with an opportunity to update the community on the status of our vaccine and the process as it stands today. Thank you.
Thank you, Dr. Singh. Ladies and gentlemen, this pandemic is far from over, even though we have a vaccine coming out. So please, let's remember to social distance, to wash our hands, and to wear masks when we can't social distance with each other. Have a happy holiday season and a happy new year. So let's be safe, and I'll talk to you again soon. Thank you.